Okay. So what do you do?
So I'm an otolaryngologist, head and neck surgeon in training at the University of Michigan. So basically, the other name for that is an ENT, resident physician, ear, nose, and throat. And so basically, our specialty is a surgical one. We specialize in treating diseases of the head and neck, and then specifically, we do a lot of ear surgery. So patients who are deaf and need a cochlear implant, we do those types of surgeries. I would say I get most of my mannerisms like I think more like my mom. Yeah, she's more she's more analytical, more logical. I do a lot of community outreach. At least when I was in Kentucky, I did a lot of community outreach in elementary schools, middle school. So that way they knew like when it was possible when they were getting a doctor. But also, like, there's so much for us to like teach. These kids, they can be ambassadors for their family. So we were talking about like the whole salt thing. The whole salt thing we were talking about with cooking, right? Like when it comes to high blood pressure.
I know what you mean.
Like we get a chance to teach kids at a young age. We don't have to put a pound of salt on this meal.
It's old people 50. What's time?
Yeah, because old
That
is
ain't
not
far
50.
from where I am right now.
Oh, that 50?
Old is not 50.
What's old to y'all?
Old is
67.
yeah, at least
67.
I would say
70.
70.
Yeah, more 70, 80.
65. You know?
Yeah, 65.
Yeah, that's old.
Like when I hit 30, I'm just gonna call myself an old nigga.
You bet. To him, how he's 29. Is he old to you?
29. Once he hit 30, 30 is old.
There'll probably be some jobs that are like, I wouldn't say replaced by AI, but AI definitely like is gonna step in and take over some labor. So probably won't be as many jobs. But there's gonna be jobs to replace, there'll be jobs to basically help the AI, do those kind of jobs or with maintenance for AI. Like, there will be more jobs possibly because of AI, right? Like, who's gonna build it? Who's gonna maintain it? Who's gonna do all the quality improvement stuff?
But they ain't never replaced my job.
No, I ain't trusting the robot. I ain't trusting no AI haircut.
AI haircut?
Nah.
Bro, I promise y'all, this whole thing is gonna be AI. I think this whole
I
thing
ain't
is
gonna
gonna
have
be
an
AI.
AI haircut.
No way. There is no
They're
way.
gonna put your hair cut.
No.
Like on the Jetsons.
I'm a black person. We ain't having it.
Right.
We ain't
Like we
having
got some
that.
super cuts.
Right, it's super cut. Yeah. Not the black folks. No sir, y'all we too big.
You ain't gonna mess with my hairline.
Huh?
They
AI's
gonna
not
be
gonna mess
pushing
with my
people's
hairline.
hairline back.
There's no way to do this. No way. AI doing something like this? Never in a million years.
Alright, come on. You know we document stuff.
Yeah. I don't believe on that.
10 years later.
I'm not even 30 yet.
Damn.
Well, I had 2 years off in between. What was it? 2 years after college, I went to DC and did research at NIH. And after that, I went to med school. So that's 2 years that I took off. So I'm gonna be 33 by the time I'm done. Yeah, they knew. I think because I was just like that kind of student that was very driven and also just focused.
They did push you though, right?
They didn't really have to. Oh no, absolutely. I would go it even longer.
She gotta talk and everything. Yeah, I just say what you kind of
Shut off. Look at this.
I just heard it.
One of the reasons I grew it out too was like it's part of my journey starting residency, and plus, like that's the representation we need. Trying to get on it. I think that's the 2024 goal. Is getting a routine. My alarm usually goes around 3:30.
Stop talking to him.
Oh yeah, I gotta be. Let's see, I usually gotta be at work around.
Just tell me you want me to talk loud.
Every time.
Yeah, I usually gotta be at work around 5. So I get up around 3:30, leave the house around 4.
What's the dream?
Dream.
Oh, Joe, I come pick you up.
Look, I'm living
Take
it.
$5 out of the cut.
Doctor. Like,
Come pick you up, Joe.
I don't really
Just trim
what's so specially I'm gonna do yet. So I don't know if it's gonna be. I don't know if it's gonna be plastics. I don't know if it's gonna be pediatrics, ENT. But all in all, I think like having a stable career having a good family, being a provider for them. That dingly thing, as Cardi B once said, is the uvula, and so that hangs in the middle of the throat. But on the side, on the right and left of that, you have your tonsils, and sometimes those can grow so much or get so swollen after an infection that it can be difficult for people to breathe at night. They get sleep apnea, or they just get recurrent infections. So kids, a lot of the time have to go taken out. So we do those ear surgeries. We do facial plastics as well. So your nose jobs, your Botox, your lips, things like that. A lot of people go into these. You can go into two different areas of medicine. You can go academics, or you can go to private practice. The ones you're talking about, these big private practice, surgeons are all on social media now, and that's a lot of the way that they build their clientele is, advertising their work. So, but yeah, that's definitely put ENT, I think, on the map a little more too. Is a lot of these celebrities posting on social media, or you see them getting their surgeries on Instagram and all that,
With Dr. Such and Such.
Exactly, yeah, exactly. So, yeah.
Gonna meet that dude one day, Dr. Miami.
Dr. Miami.
Don't even know what he look like.
I think Dr. Miami might be just general plastic. So he does plastic surgery on any part of the body. Whereas we just do plastic surgery on the face. Yeah. So no BBLs on the ENT side. Yeah.
That's what they get nowadays.
That's everybody's in line. People don't realize there's risk with every surgery, and no surgery comes without those risks. Yeah. So you think about these cosmetic things that may help a patient's self-confidence, or these are things that they may want themselves, but it's always important to remember they're at risk, and so you got to weigh those with the benefits as well when you're thinking about surgeries like that. So especially with these BBLs going around, so
don't look.
And then you got another surgery after that. It becomes a cycle.
You think people get addicted to the surgeries?
I think you do see that. Yeah, there's definitely psychiatric condition. There's a body dysmorphia that we think about in patients who feel the need to get surgery to get to a certain area where they feel like they internally match their reflection, or their reflection matches their internal being or their vision. And so you do have to think about that, I think, with your patients too, is make sure that they understand the expectation of surgery. They know what they're gonna get coming out of the surgery, and it's gonna match what they have in their mind. Because if not, you're just gonna basically be operating on these patients, and they won't be happy because you'll never make them into the vision that they have for themselves. You got to think about reality